You are now listening to Nailed It, the Orthopedic Surgery Podcast.
The hot topic, or I guess a very common topic, is ACL injuries. And if we can you kind of touch on some of the risk factors that lead women to have an increased chance of having these injuries, and kind of how these injuries can be prevented, and then we can also touch about the treatment and kind of surgical options for these patients.
Yeah, this is definitely a very, very common injury, much more common in female athletes than male athletes. And really, it can be upwards of like 6 to 8 times more common in female athletes for a variety of risk factors, or for a variety of reasons. Really, the risk factors are broken down into 2 main categories. Those are modifiable and non-modifiable risk factors. So the non-modifiable things, those are obviously things we can't change, right? So that's hormonal fluctuations, that's, sex-related differences in knee anatomy, the size of the notch, the size of the ACL. We can't change those things. And so we acknowledge it, we recognize it, but there's nothing we can specifically do about that. The other category of exercises or risk factors are the modifiable risk factors. And those are biomechanical risk factors, the neuromuscular risk factors. So this has to do with the landing patterns of female athletes. So females tend to land with a valgus alignment of the knee, and that puts a tremendous amount of stress across the ACL. Additionally, female athletes tend to decelerate they have a quad dominant deceleration pattern. So what that means is, as female athletes are slowing down, the quads are activated, and that's all well and good, but why do we care? We care because the quads then translate the tibia anteriorly, which puts a lot of stress across the ACL. Now, in male athletes, there's much more of a balance between the quads and the hamstrings, so they don't have that pull anteriorly, whereas in the female athletes, the quads are way stronger than the hamstrings. And so in our injury prevention programs, we really focus on those components. We focus on landing mechanics. We try to eliminate that valgus alignment of the knee when athletes land, and also work on strengthening and evening out the balance between the quads and the hamstrings.
Yeah, I think that's really important, just to kind of highlight some of the things you were saying, that quadriceps, that kind of when they decelerate, that leads to increased anterior tibial translation. You also know the valgus in the knee as well, which also puts more stress on the ACL. And so again, what are some of the things that you should, I guess, counsel a young athlete about, as far as her landing from jumping or whatever activity it may be? What are some of the things, again, that we should just kind of focus on, just to recap?
Yeah, so I think another key component with regards to landing specifically is that female athletes tend to land with stiff knees and stiff hips. So as we're talking to our athletes about this and thinking about how they're landing, you can think something as simple as landing kind of like light as a feather, right? You land in a flexible kind of athletic position. So you land, let the force then be absorbed by the knees and the hips. And that makes it much less likely that they're going to tear their ACL. So it's both the alignment of the knee and the fact that they tend to land with stiff knees and stiff hips. So those are the things that we really focus on when we're trying to teach athletes, our female athletes in particular, to land appropriately. Now, male athletes, it's just sort of inherent. Like, male athletes tend to land with proper form, whereas female athletes don't, and that's just the way sort of females are designed. So it's really important to start teaching these things as early as possible. So ideally, kind of, we're emphasizing these things at the middle school level. So before all the sort of biomechanical changes happen as female athletes go through puberty. So if we can catch it when the female athletes are in middle school, we have a much higher chance of decreasing that risk of ACL tears.
Yeah, I think that's super important to counsel these athletes as early as you can, because again, this kind of helps prevent against injury, and helps make play better, better, less injuries, and I guess funner play per se.